Lescian Corla, this morning phone calls were made all over Ireland cancelling surgery for men, women and children. These calls are now being made every morning. On budget day alone, here's a sample of those calls. Limerick, all surgical appointments cancelled. Galway, half of surgeries in certain specialties cancelled. The Mater, except for cancer patients, all elective admissions cancelled. James's, 4 of their 13 operating theatres closed. Beaumont, 15 patients in need of urgent neurosurgical care not transferred. Lescian Corla, today, thousands of parents around Ireland are asking in desperation when their boys and girls are going to get help. In some counties, children with special needs are having to wait 3.5 years to see therapists. In other counties, parents are being told that there is no waiting list because there are no therapists. Children with scoliosis are not being operated on for 3 years, and that means that their spines are being allowed curve to 100 degrees, more than twice of what happens in other European countries. And in some cases, like that of Aaron Daly and his daughter Sophia, parents are being told that because they've been waiting so long, surgery is no longer possible. Lescian Corla, today, doctors all over Ireland will meet patients who have life-threatening and terminal conditions. And in some cases, those doctors will know that had they seen those patients earlier, had the diagnostics been done sooner, had the patients not had to wait so long, those patients would be treatable. This is the reality of healthcare in Ireland today. This is what the budget needed to address. And you'd think with a spending increase of €1.6 billion, it could have done that. But it didn't do that. As with so much from this government, the health budget is spin. It's an optical illusion designed to make the government look busy while disguising its failures. The government boasts of huge additional spending. It states proudly that this is a sláinte care budget. What absolute drivel. Here are the actual figures. Total spending on healthcare will increase by €1.6 billion. That's an amount of money that could have made a huge difference. It could have got tens of thousands of people the treatment they needed. It could have built beds, it could have hired clinicians, it could have funded new drugs. It could have launched Sláinte Care, the plan to modernise our healthcare system so people don't spend years waiting on lists, so they can access healthcare not if they can afford it, but when they need it. But in spite of beginning the year with the biggest health budget in the history of the state, Minister Harris will end the year with the longest waiting lists in the history of the state and still will have managed to overspend by €750 million. So what's the result of that? Of the €1.6 billion, €2 in every 5 will be needed to cover the overspend. Another €2 in every 5 is needed for pay agreements and demographics, which leaves €1 in every 5 for improved services. And of that €1, about 10 to 15 cents is actually for Sláinte Care. At least €600 million is needed to launch Sláinte Care, but due to government mismanagement, it's going to get less than a tenth of that, which means that next year it's not going to happen in any meaningful way. Public spending on health has grown every year since 2013. Total spending on health has grown every year since 2010. In 2016, Minister Harris inherited the biggest health budget in the history of the state, one of the highest per capita spends anywhere on earth. In 2017 and 2018, that budget went up and up again. But somehow, people are now waiting longer than ever before to see doctors, to get scans, to be operated on. There's a recruitment crisis in our hospitals, consultant posts can't be filled, 6 in 10 GP surgeries can't take on new patients, nurses are considering strike action for the first time in 20 years, and yet on top of this, we hear on Tuesday that the Minister has also overspent by €750 million. So now we're told there isn't the money. €750 million can be found down the back of the couch to pay for mismanagement. But can money be found to pay for children with special needs, for children with scoliosis, for life-saving drugs, for the reversal of FEMPI for GPs, for pay equality for new entrants, for sláinte care? No, we're told. It can't. The budget details last Ceann Comhairle were still being agreed on Monday. So given the severity of what was announced on Tuesday, you'd expect the Minister for Health to be at work, fighting for patients and clinicians. That's what the Fianna Fáil team was doing. What the Minister for Health was doing was opening a playground in Wicklow. The healthcare system is in crisis. Official figures put the waiting list at now over 700,000. Add those waiting for diagnostics and mental health and children waiting for therapists, and you get to 1 million. None of this is inevitable. Healthcare is not some unfixable black hole. Between 1997 and 2010, Fianna Fáil increased healthcare spending too. It opened 1,600 hospital beds. It added 40% more consultant posts. It set up the nursing degree and doubled student nursing places. It launched the national screening programmes. It launched the national cancer strategy. It introduced a massive increase in home care. So what happened? Deaths from cancer fell 11%. Infant mortality fell by 1/3. Cardiovascular disease fell by 40%. Death from heart attack fell by 1/2. Death from stroke fell by 1/2. The credit for this doesn't go to Fianna Fáil. The credit for this goes to the doctors, nurses, allied health professionals, scientists, and all of the other amazing women and men working in our healthcare system. But what Fianna Fáil did know how to do was work with those people to get results on behalf of patients. Waiting times fell from years to months, but not anymore. In 2011, the number of people waiting more than 6 months for a hospital appointment was less than 10,000. Today, it is more than 35,000. For every one person who was waiting more than a year for surgery in 2010, for every one, there are now 20 people waiting more than a year for surgery. How is it possible to mess things up so badly in healthcare, given so much money? If the €1.6 billion announced on Tuesday represented real new investment, then I would welcome it. If it had the foresight to reverse FEMPI for GPs and not tie that to a new GP contract, I would welcome it. If it comprehensively addressed the fact that we can't recruit doctors in our hospitals, I would welcome it. If it was used to improve the working conditions for nurses, I would welcome it. If it was being used to build enough new community and hospital beds rather than cover overspend, I would welcome it. But it does none of these things. Our doctors and nurses next year will remain overstretched. Our hospitals will remain over capacity. Our patients will continue to wait and to suffer, and every one of them deserve better. Thank you.